So now we're going to talk about the shaft of the tibia. So the shaft of the tibia has 3 borders and 3 surfaces. This here is the anterior border, this is the lateral border, and here we have the medial border. Now the anterior border, as you can see here, is curved in such a way that the in its upper part, its convexity is directed towards the medial side, and in its lower part, the convexity is directed towards the lateral side. Now, the anterior border is continuous above, just underneath the tibial tuberosity, right? So this is the tibial tuberosity, and just below that is where the anterior border commences. So it starts from here, curves like that, and then goes down and is continuous all the way to the anterior border of the medial malleolus here, right? And the anterior border is the most prominent of the 3 borders, and this anterior border is subcutaneous along with the medial surface of the tibia, which is between the anterior and the medial borders. And this surface actually forms the shin, right? So after the anterior border, let's talk about the medial border. So the medial border would be this one here. Now this medial border starts from the medial, just underneath the medial condyle, and goes all the way here down, and below it is continuous with the posterior border of the medial malleolus. And this medial border is not very sharp or very well defined. It's quite rounded and not very sharp, right? So between the anterior and the medial borders, you have the medial surface here. So this is the medial surface of the shaft of tibia. It's between the anterior and medial borders, and it is subcutaneous, and it forms the shin. Now on the lateral side, you will have the lateral border. Now this is the lateral border of the shaft of tibia. The lateral border starts above, just underneath this fibular facet. It goes down all the way here, and in its lower part, this lateral border, it then splits to form a triangular area, and this triangular area here in its lower part here forms a notch, which is known as the fibular notch. And this fibular notch is where the tibia articulates with the fibula to form the inferior tibiofibular joint. Between the anterior border and the lateral border, you have the lateral surface. So this here is the lateral surface of the tibia, and between the lateral and the medial borders, you have the posterior surface of the tibia, right? So this is the posterior surface of the tibia, and this surface is divided by the presence of an oblique ridge into an upper triangular part and a lower longitudinal part. Now this oblique ridge is also called as the soleal line. We talked about this earlier when we were talking about the popliteal fossa. So the soleal line formed the deep lower boundary of the popliteal fossa. The soleal line is the oblique ridge on the posterior upper part of the posterior surface of the tibia, which is where the origin of the soleus muscle takes place, right? So this here, an oblique ridge here on the posterior surface, is known as the soleal line. So above the soleal line, you have a triangular part, and underneath the soleal line, inferior to the soleal line, you have a longitudinal part. Now this longitudinal part on the posterior surface is then further divided into a medial and a lateral part by the presence of a vertical ridge. You can't really see it in this bone, but there's a vertical ridge in the lower part of the posterior surface of the tibia, shaft of the tibia, and this vertical ridge then divides the lower part of this posterior surface into a lateral and a medial part, right? And here is the soleal line, and near this you can see here, you can see a nutrient foramen here. It's a very prominent nutrient foramen from where the nutrient artery enters the tibia, and it is this nutrient foramen is directed downwards, and which means that the growing end of the tibia is this upper end, right? And in fact, the epiphyseal line of the upper end of the tibia, it actually passes. Now there's the two parts of the tibial tuberosity, a rough part and a smooth part. So at the junction of these two parts, in the center of the tibial tuberosity is where the epiphyseal line passes in the tibia. Now let's talk about the lower end of the tibia. So this is the lower end of the tibia. It has 5 surfaces, right? So if you can see the whole of the tibia, this is the tibial tuberosity. So this would be the anterior surface of the lower end, right? So this is the anterior surface. As you can see, this here is the medial malleolus. So this is the medial surface of the lower end of the tibia. Moving it further, and this is the posterior surface. Now the posterior surface actually has grooves in it, where the tendons from the posterior compartment of the leg then travel and go into the foot, right? Moving it along a little more, and here you can see the lateral surface of the lower end of the tibia. Now this lateral surface here has a notch, which we just said a little while ago is responsible for the articulation with the fibula to form the inferior tibiofibular joint. So we've done the anterior surface here, the posterior surface, the lateral surface, and the medial surface, and the 5th surface would then be the inferior surface. So this here is the inferior surface. This is the inferior surface of the lower end of the tibia, and this inferior surface of the lower end of the tibia is actually responsible for articulation with the talus, right? So this is the articular surface which articulates with the bone known as talus, which is a bone of the foot to form the ankle joint. So just a brief overview, a review rather, of what we've done so far. So we've done the bony features of the tibia today. We talked about the fact that the tibia has an upper end and a lower end, and it has a shaft. Now the upper end of the tibia, let's move it like this. Okay, so now this is the posterior surface. So the upper end has 2 condyles, a medial condyle, a lateral condyle, an intercondylar area, and a tuberosity. And the medial condyle is more oval, the lateral condyle is more circular. On the periphery here as well as here, you have the presence of menisci, and the central part of the articular surface is deep. Now in addition to that, the medial condyle has a groove here where semimembranosus is attached. Then on the lateral condyle, you have anteriorly there is an impression which is known as the Gerdy's tubercle, where the iliotibial tract is attached, and posteriorly you have a facet which is for the superior tibiofibular joint. You also have a groove here on the lateral condyle for the tendon of the popliteus muscle. This is the intercondylar area, which has the intercondylar eminence and the medial and lateral intercondylar tubercles. Then you have the tibial tuberosity, where there is insertion of the ligamentum patelli. Now then we move on to the shaft. Now an overview of the shaft: it has a curved anterior border, which is quite sharp and the most prominent. Then you have a medial border and a lateral border. The medial surface, which is between the anterior and the medial borders, is subcutaneous. The posterior surface between the medial and the lateral borders is divided by the presence of the soleal line into an upper triangular part and a lower longitudinal part. And then in the lower longitudinal part, you have a vertical ridge which divides this part into a medial and a lateral part. And between the anterior and the lateral border, you have the lateral surface. And then we talked about the lower end. So the lower end has 5 surfaces. You have the anterior surface, you have the medial surface, you have the lateral surface, then you have the posterior surface, and the posterior surface has grooves for the passage of tendons. So this is the posterior surface. So the posterior surface has grooves for the passage of tendons of muscles in the posterior compartment of the leg here, and the medial surface here forms the medial malleolus, and the lateral surface has a notch which is known as the fibular notch, where the inferior tibiofibular joint is formed. And then you have the inferior surface of the lower end, which is articulating with the talus of the foot. So that's it about the bony features of the tibia. We'll talk about the muscle attachments of the tibia in detail in tomorrow's lecture. Thank you.